Come in.
Hi, I'm Jackie. I'm going to be your nurse today. Can you please just tell me your name and date of birth?
Patricia Mustang, 6/1959,
And Patricia, do you know where you're at today?
in the hospital.
Okay, so patient seems to be alert and oriented ×3. So what we're going to do today, Patricia, is I'm just going to do a head-to-toe assessment since you were admitted here with us. I'm going to take your vital signs, so listen to your heart and your lungs, take your blood pressure, and then I'm just going to inspect some areas of your body. Is that okay with you, Patricia?
Yes.
Okay, and you are being recorded. Is that okay with you as well?
Yes.
Okay, so we're going to start with your vital signs, and I'm going to start with your temp. It's going to run along your forehead here. Okay, so I have a tympanic temperature of 97.9. And then I'm going to go ahead and take your blood pressure, and I'm going to put this finger probe on your finger. It's going to test your oxygen and your pulse. Just relax your hand there. I'm going to come on this side, and I'm going to get your blood pressure. If I can have you just put your feet flat on the floor, scoot forward. There we go, perfect. You okay like that?
Yes.
Okay. So just relax your arm, turn your palm up like that, perfect. Okay, so blood pressure with patient sitting on the left arm is 138/76. And I have a pulse rate of 90 and oxygen of 98%. Room air on finger probe. I'm just going to go ahead and check your pulse rate here. So pulse rate is equal, +2. Radial pulse is 92. And I got a respiration of 18. So I'm going to go ahead and just inspect your scalp area and just check your facial features here. So I'm just going to go ahead and look at your scalp. So looking at the scalp, there's no apparent signs of skin breakdown. I don't feel any dents or any lacerations in the head. Scalp seems to be clean, hair feels a little brittle. So I'm just going to go ahead and look at your eyes here. Go ahead and look at my nose. Okay. Okay, pupils are equal, round, reactive to light. I'd say they're about 3 millimeters in size, equally. If I can have you just tilt your head back a little, I'm just going to look at your nose here. So I don't see anything in the nose at all, any obstruction. When I push on your face here, do you feel any pain?
Just a little sinus.
Okay, a little sinus pressure. Looking at the patient's lips on the outside, I do see that they are pink, moist. They're not cracked at all, no abrasions or anything on the outside. If you could just say, ah, stick out your tongue for me.
Ah, ah.
Tongue is red and beefy. Looking at the mouth here, it seems, Patricia, that you had your teeth removed.
10 years ago.
Okay. I don't see any abrasions or anything in the mouth. Gums seem to be okay. You can go ahead and sit back if you're not comfortable. There we go. Okay, and I'm just going to look in the ears here. So looking in the ears, I don't see any redness. There's no signs of skin breakdown on the outside. Any pain in your ears at all, Patricia?
No.
No, no pain in your ears. Good. Okay, and when I feel here, do you have any pain at all?
No.
Okay, I don't feel, on palpitation, I don't feel any nodules or any bumps or anything. If I can have you just move your head backwards for me and then forward. Any pain when you do that?
No.
Left side, right side, any pain at all?
No.
Okay. And when I lift your arm up here, any pain in the shoulder?
No.
Any pain in the elbows at all?
No.
And then when you move your wrist up and down, any pain?
No.
Okay. I'm gonna do this side. Any pain when I lift?
No.
Any pain here?
No.
Okay, what about when you move your wrist? Any
No.
pain in the wrist?
No.
You can move your fingers okay? A little pain?
No.
Okay. Go ahead and squeeze as hard as you can. Okay. So it seems that the patient has equal strength on both sides, a little weak, but they seem to be equal strength. So I'm going to go ahead and listen to your heart and lungs now. Just sit quietly, breathe normal. I'm going to listen to your heart first. So I'm going to start with the aortic. You can breathe normal. And then the pulmonic. And then the herbs. The tricuspid. And then the apical pulse. Okay. I hear normal heart sounds. I don't hear any signs of murmur or anything like that. Patient seems to be a little tacky, but otherwise heart sounds sound pretty good. I'm going to listen to your lungs now. You could just take a deep breath for me. Listen to the trachea. Okay, good. Anterior. Right anterior, good. Okay. Good. Okay, and the mid-axillary here. Good. Other side here. Okay. Other side here. Okay, perfect. And I'm just going to listen to your back area. So one here. Two. Another deep breath for me here. Perfect. Okay, in the posterior part of the lung and between the fourth and fifth intercostal right and left areas, I do hear some wheezing sounds. Patricia, do you have a history of any breathing respiratory problems?
Yes, I do.
And could you tell me what those are, please?
COPD and asthma.
Okay, so patient does have a history of COPD and asthma. So then we're going to go ahead and listen to your stomach area here. Could you just tell me when the last time you had a bowel movement?
This morning.
And was that normal for you?
Yes.
Okay, perfect. So if you just relax yourself, I'm just going to listen here. So I'm going to start with the left upper quadrant. So hyperactive bowel sounds in the left upper quadrant. Hyperactive sounds in the right upper quadrant. Hyperactive in the right lower quadrant. And also hyperactive in the left lower quadrant. Okay, I'm just going to push on your stomach a little bit. You let me know if you have any pain. Okay, how about here when I push?
No.
No pain in the left upper quadrant? Lower quadrant?
No.
Okay. How about here in the right side?
No.
Any pain? How about here?
No.
And then the center here?
No.
Okay, and do you have any history of any abdominal surgeries at all?
Yeah. hysterectomy
Okay,
and hernias.
okay. And so then I'm going to I would then inspect your breast area just to make sure. From appearance, it looks like the breasts are symmetrical on both sides. Any drainage or anything?
No.
Okay, perfect. So I'm just gonna palpate a little bit. And then I go underneath. No apparent signs of skin breakdown. On palpation, I don't feel no signs of any nodules or anything like that. So I'm gonna have you just put your feet flat on the ground for me, Patricia, please. Just be careful there. If you could remove your shoes. I'm gonna feel for a pedal pulse, so I'm gonna check the dorsalis pedis on the top here. Okay, +2 on the right side. +2 on the left, so equally on both sides. I'm looking, there's no apparent signs of edema. I don't see any varicose veins or anything like that. And if I could just have you push down on both of my hands. Okay, strengthen both extremities, lower extremities are equal. And if I could just have you stand up for me, Patricia, and just walk a little bit. And how's your walking? Are you able to walk okay on your own?
Yes.
Perfect. No pain when you walk in the hips or anything like that?
No.
Okay, you can come back over here and have a seat. Are you able to use a bathroom on your own?
Yes.
Okay, so I don't see any drains or any tubes at this time. So we're gonna go ahead and that's it for what I have today. But I am your nurse, and if you need anything, just give me a call. Your call bill's here if you need to, and if there's anything else I could do for you, just let me know, okay? It was nice to meet you, Patricia.
Thank you very much, Jackie.
You're welcome.